the seventh leading cause of deaths in the United States. The CDC and the ADA have said that 79,535 deaths occur each year from diabetes. I am a diabetic. I was told 3 years ago that I was a type 2 diabetic. Being a nurse, I've checked people, diabetics, for years, and I had no problem sticking their fingers and giving them insulin. But when it came down to me having to do it to myself, I had an issue. I was frustrated, I was angry, but I knew that I had to accept this diagnosis and do what I had to do so that I can live a normal life, being a diabetic. So one of the most easiest things that we can do as a diabetic is to learn to check our blood sugar. We have to maintain a blood sugar between 70 and 120, and that is the normal blood sugar range for any diabetic. Anything below 70, you could be called hypoglycemic, which could result in you passing out, being unresponsive, unable to get help, which could result in death. Anything over 120, you will be considered hyperglycemic. That is when the diabetic has the most problems, that causes damage to their organs. High blood sugar attacks all your major organs, and I'm talking about from the top of your head to your feet. It attacks your heart, your lungs, your abdomen, your vision. It attacks your kidneys, the liver, and also your circulatory system. And these major organs, if attacked by enough high blood sugars on a daily basis, can cause damage, eventually leading to death. That's why we need to learn how to check our blood sugar accurately. What we need to do first is that we have to go and get an Accu-Check machine. This is my glucometer, or an Accu-Check machine, and this measures your blood sugar. And I check mine just once a day since I am a type 2. And I record it on a log. That's also what you need to do. So you'll need your glucometer, your lancet, and a lancet gun. I'll show you how to load that. And you'll need your strips. That's what measures your blood sugar accurately. Now your strips have to coincide with your glucometer. And you have to make sure you have the right strips, or you're going to get a negative or a wrong reading. It won't be negative, but it will not be accurate for you, which can cause you more damage. So the first thing you do is you need an alcohol pad and a gauze, a 2x2. You can get these at any drugstore. When you pick up your glucometer and your lancet and your strips, you can pick those up too. So what I do is I wash my hands, and since I don't have running water right now, I'm just gonna go through the motion. You wash your hands, and you know, just like with COVID right now, we're doing a lot of hand washing, sing the happy birthday song, and then you're done. After you're done that, let your hands dry, open your alcohol pad, choose which finger you're going to use. While you're deciding on which finger, you can load your lancet gun. Okay, you take your lancet, put it into the gun, put the lid on. Some just screw on, some just pop on. Mine just pops on. Now, then you pull it back. Okay, it's loaded and it's ready to go. You're going to take out your strip. Put your strip into the machine. You're going to put the wide square end into the machine. This is what mine is. Each machine is different, so if you are a diabetic or somebody in your household is a diabetic, you have to get to know your machine. Then I'm going to rub my finger. I'm going to clean the tip of my finger. Don't wave your finger around. Don't blow on it like you see in the movies. That's not how you do it. Okay? You just let it air dry. That way you're not introducing any germs or anything else onto that spot where you're going to stick. Now, stick on the side of your finger, not on the middle, as a lot of people see it done on the television. Again, not so. You're going to push the gun right here, stick it on, and just maybe think of something pretty, something different, because it's no fun injuring yourself or inflicting pain. So here we go. 1, 2, 3. Ah. Now, you have a little blood. Hope nobody's afraid of blood. Don't pass out on me while you're watching this. And once you get a little dab of blood, you take your machine, and it should be ready. If you waited too long, take your lancet out, your strip, and put it back in again. And just put your blood right up there. It'll suck it up. And see, my machine beeped, and it's counting down. I have a blood sugar of 97. That's good range for me. So after I've done that, I record it, and I'm done. That's how you take an accurate blood sugar, and this can prevent you from doing damage with uncontrolled blood sugars. It's one of the easiest ways we can do it. Again, you need your glucometer, your strips, and your lancet gun. And you're well on your way to checking your blood sugar accurately. If you need any further information or have any questions, go to the ADA, American Diabetic Association, their website, and they have numerous information for any diabetic. I hope if you are a diabetic, follow your doctor's instructions and take care of yourself.